Hi all. The Central Compliance Function, alongside the National Office of Protected Disclosures, delivered two webinars at the end of March 2026, providing an overview on our operations. Post those webinars, we had a lot of queries about the availability of recorded sessions, so we are preparing a recording here. Two separate versions. One for the protected disclosure side of the house will be up on the NOPD webpage, and this Central Compliance Function webinar will be available on our own Central Compliance webpage. My own name is David Langton, and I'm the Assistant National Director of the Central Compliance Function, also known as the CCF. And I'll give a brief introduction on the origins of this CCF, to describe its main purpose before handing over to the Central Compliance Function team. So I'm joined today by my colleagues, Rosemary Graves, the General Manager of the Central Compliance Function, and also Mike Malloy, who's a Compliance Manager within the Central Compliance Function. The HSE is committed to ensuring compliance with our obligations, including applicable statutory, regulatory, public policy, internal policy, and professional obligations. However, over the years, there have been a number of compliance weaknesses identified through internal audit opinions, the Statement of Internal Controls process, CNAG reports, and regulatory body reviews. KPMG were assigned to examine the compliance landscape in 2022, and they issued their final report in November of that year, in which 47 recommendations were made. While areas of good practice were identified across the various compliance pockets that exist in the HSE, the report recommended the establishment of a central compliance function tasked with developing the compliance framework for the organisation and leading out on reshaping the compliance landscape within the HSE. The CCF was officially set up in 2024 and sits independently of operational management. We're a national function, and we sit in the corporate centre under the National Directorate for Public Involvement, Culture and Risk Management, which is led out by Joe Ryan. Our office's remit is to ensure the HSE operates in compliance with applicable laws and internal policies, and make sure staff are aware of these relevant laws and internal policies, and also the consequences of non-compliance. I'm now going to pass you over to Rosemary, who's going to begin the main part of the presentation.
Thank you, David. I'm Rosemary Gray, Manager of the CCF. My colleague Mike Malloy and I will talk to you today about the importance of compliance in the HSE and how the CCF is leading out on strengthening the compliance culture across our organisation. Our agenda today covers the importance of compliance, describes the heavily regulated compliance environment in the HSE, before specifically looking at two compliance tools that the CCF have designed and operationalised last year, namely the Compliance Obligation Register and the Principal Compliance Obligation Register. Following the rulebooks is crucial for all staff to ensure compliant HSE services. We are all users at some stage in our lives and expect to receive safe health services. The HSE has a legal and ethical duty to provide safe health services in compliance with these external laws and internal policies. Compliance must be much more than a box-ticking exercise of filling out forms and filing reports to satisfy audits. As we carry out our daily jobs, compliance is about each of us encouraging a culture of doing the right thing in the right place at the right time. In our daily jobs, we must follow the standards set out in the laws and our internal policies. And in that way, we are maintaining stable practices, supporting financial viability, and helping to protect the public trust in our organisation. You may be familiar with the following newspaper headlines regarding non-compliance with HSE obligations and the resultant consequences. The HSE facing an inquiry into 2 leaks of patient data and failure to safeguard medical records. A HICWA report into CHI at Temple Street regarding the use of non-CE marked spring implants used in spinal surgeries on children. The Mental Health Commission has found patients at a number of HSE-run mental health centres are receiving substandard care due to persistent, critical non-compliance with regulations. Internal audit reveal that the HSE wrote off nearly 1 million in salary overpayments. The HSE was unprepared for the cyber attack due to the weaknesses in their IT system and a lack of cybersecurity detection and monitoring. The cyber attack has cost the HSE approximately 100 million, while the attack itself saw massive service disruption across the country, with usual healthcare operations being curtailed. As mentioned in an earlier slide, the HSE operates in a heavily regulated landscape, with a significant number of external laws and internal policies that the HSE must comply with. Our challenge is knowing what these are, how they impact what we do, and keeping up to date with the new and ever-changing laws and policies. Mike will talk to this in more detail later in this session in presenting on the Compliance Obligation Register. Compliance is taken seriously in our organisation and is monitored regularly by the HSE leadership team. Compliance is one of the 11 risks on the Corporate Risk Register. This slide shows an extract from that register. The compliance risk is described as a major failure to meet a significant statutory, internal control, or regulatory obligation. In a previous slide, I described the impact of non-compliance. I would like to draw your attention to the box on the bottom right of this slide, describing the HSE's strategy to lessen this risk of non-compliance. And we in the CCF are a central component of this strategy. A hub and spoke model is the structure connecting the national directorates as depicted on this slide, 6 RHAs, centre functions and national services, with the CCF centre positioned. There are 28 functions identified as performing compliance activities spread across these national directorates. This model is designed to deliver on the HSE compliance framework. The spokes are responsible for compliance operations in their respective areas and for providing information to the CCF to support the CCF tabling reports on compliance matters to the senior leadership team and the Audit and Risk Committee. The CCF manages the Compliance Obligation Register and the Principal Compliance Obligation Register, and the services highlight items for inclusion and/or deletion in both these registers. A compliance network has been stood up and is chaired by the CCF. Membership consists of compliance leads from these 28 functions I just mentioned. Membership predominantly comes from the CCF, RHAs, HR, clinical and finance. Membership has changed since the initial setup and is currently under review again by the HSE leadership team. The compliance network is a valuable knowledge-sharing forum where functions share insight, good practice, and provide a general overview of the work they undertake. As David mentioned, KPMG consulted with the HSE on the first compliance framework, and it is a bells and whistles version. This next version, which is at final draft stage, is being amended to fit the current organisational structure and to provide the blueprint of the processes the HSE wants in place to manage the compliance landscape. On a closing note, compliance is often seen as nice to have, while operational matters take precedence. We need, as an organisation, to strive to push a compliance culture that views compliance as a must-have. I'm going to pass over to Mike at this juncture, and Mike will be looking at the Compliance Obligation Register and the Principal Compliance Obligation Register.
Thanks, Rosemary. My name is Mike Malloy, and I am a Compliance Manager in the CCF. The HSE has in place now, since the end of 2024, a list of all the laws and internal policies that it must follow. We refer to this list as the Compliance Obligations Register, or the CORE. There are currently over 1,350 laws, regulations, and internal policies on the register. This listing ensures all of us staff at all levels of the organisation, right up to the board members, always know the location of the rules that we must follow. Key benefit of having a core ensures an in-place knowledge bank of the obligations, which supports prompt identification of rules that we must comply with, thereby reducing the risk of non-compliance. The core also supports all staff to be more accountable for their compliance. This slide shows an extract from the current Compliance Obligations Register. This register contains one listing on external obligations and standards and 5 separate category listings for internal HSE own policies, known as PPPGs. These PPPGs are primarily in place to enact these external obligations and standards. A PPPG is a national policy, procedure, protocol, or guideline. The listings are in date order per category based on when they came into effect or the policy date. The core is split up into 3 areas. The first page is a summary page. The next section details the external obligations, of which there are over 500, made up of laws, regulations, public policies, and directives. And the final section details the internal obligations, of which there are over 850, made up of PPPGs, which are often issued by the HSE to respond to and operationalise the external obligations. This core listing is available on the HSE staff webpage, and the link is on the top of this slide. As I mentioned on a previous slide, to further support staff navigate this long listing, the internal policy section is further subdivided and categorised, showing distinct policies from our HR circulars, the PPPGs that are shown in the National Central Repository, our ICT policies, our national financial regulations, and other PPPGs. Links are added for contact details of subject matter experts on these policies in the core on page 1, and links are also shown on this slide. We mentioned earlier the challenge of staying up to date with ever-changing laws and internal policies. We have developed a review and update procedure to ensure the register is reviewed thoroughly on a quarterly basis. This process involves the Office of the CEO, the Office of Legal Services, and subject matter experts representing every member of the senior leadership team. Outdated information would make the listing inaccurate, and so it is crucial these reviews are completed and the updated listing communicated to all staff. All staff broadcasts are issued each quarter to advise of the latest updated version. As can be seen from this slide, the core is an agile document with lots of changes to ensure completeness and accuracy, and that this document is kept up to date. Since the launch of the first core in 2024, the review and update procedure I mentioned has resulted in over 200 obligations added to the core, 37 obligations removed, 55 obligations where there's been a version update, predominantly updates to our PPPGs, and 6 communication programs, which included staff internal webpage updates, all staff broadcasts via emails, and also presentations to both the SLT and the Audit and Risk Committee. The core is a useful guide providing a central, clear, and easy accessible listing of the laws and internal policies. We recommend that you and your teams ensure you are aware of these laws, regulations, and policies, and the specific requirements that affect how you carry out your roles to ensure you are carrying out tasks compliantly. HSE HR function issued an induction guidelines and checklist document in 2026. This includes a list of organisation policies, procedures and guidelines that the employee should be made aware of. It also recommends tailoring departmental induction so that each line manager ensures that the appropriate policies and procedures are communicated to employees under their area of responsibility. The core can be searched to identify relevant PPPGs, as well as using the links on the first page of the core for access to subject matter experts. If you become aware of breaches, you and your team should put a plan in place to implement corrective action to return to a compliant space. For example, a payroll overpayment that followed a reduction to an employee's working hours. This may have occurred due to the HR 102 form being submitted late. Corrective actions could include refreshing everyone's awareness of NFR B3, employee administration and payroll, especially regarding the requirement to immediately inform local HR or National Personnel Administration of employee changes. Also, for the affected staff member, Section 5 in NFR B3 will assist with the process on recouping the overpayment. The NFR puts in place a process to ensure that the external obligations in the Payment of Wages Act are complied with. The CCF will also be responsible for establishing a process whereby material compliance breaches can be identified, assessed, and resolved. Our plan is to develop a monitoring mechanism to ensure these breaches are dealt with and rectified quickly. Well, 1,350 plus obligations are not practical to track, and the senior leadership team have taken the decision to take a filtered view of the longer list in the core. Instead of trying to monitor compliance with the entire list, the senior leadership team have created a watch list for 12 obligations. This register is called the Principal Compliance Obligations Register, or the PCOR. These 12 obligations have assigned owners, each being a member of the senior leadership team, and are aligned to risks on the corporate risk register. There are individual metrics assigned to each of the 12 obligations, and compliance with metric targets has a quarterly reporting cycle to the senior leadership team and the Audit and Risk Committee of the board. This slide shows an extract from the Principal Compliance Obligations Register. As an example, I will talk through the first obligation listed on the PCOR, Children First, an obligation which we are all familiar with. The Children First Act 2015 is the obligation. The metric used to assess compliance against the obligation is the percentage of all HSE employees who have completed mandatory training in Children's First, which is required every 3 years. The Chief Clinical Officer is the obligation owner. The PCOR is linked to the Corporate Risk Register, and the risk appetite is averse under patient safety / experiencer category. Averse risk appetite means to avoid the risk and associated uncertainty, and is akin to zero tolerance, as you would expect with child safety. Finally, there are 2 risks linked on the Corporate Risk Register. Risk 2, Standards of Safety and Care, and Risk 9, Compliance Risk, that Rosemary talked to you about earlier. All our day-to-day roles contribute towards ensuring that the HSE delivers safe services. As a takeaway message, all staff should be aware of the rules that apply to them, and we hope that the Compliance Obligations Register will be helpful to assist you with this responsibility. For any questions on this presentation or anything compliance related, I have included the contact details of the team and also our generic CCF email. Thank you for taking the time to watch this presentation.